My name is Caitlin Warren, and this is going to be my injection site video. So the first injection site I'm going to go over is going to be the deltoid injection site. This is the smallest of the injection sites, so we can only administer small amounts of aqueous solutions. So for this one, to find it, we're going to go 3 finger breaths below the Chromium process. You're going to take your index finger and your middle finger and create a V. And this right here is going to be your injection site. So this is an intramuscular injection, so you would administer at a 90-degree angle. The next one we're going to do is the dorsolateral aspect. This is going to be located on the upper arm as well. It's going to be at the lower back portion of the arm. So you're going to locate this, you're going to go 3 finger breaths above the elbow and 3 finger breaths below the deltoid muscle. So it's going to be this little rectangle right here. This is going to be for subcutaneous injections, and for this one, depending on the amount of subcutaneous tissue, will vary the size of the needle, and you would insert at a 45-degree angle or a 90-degree angle, depending on the amount of subcutaneous tissue. The next one we're going to be doing is going to be on the forearm. This is going to be for an intradermal injection. For this one, to locate it, you're going to go a hand breath above the wrist and a hand breath below the bend of the elbow. So it's going to be this rectangle right here. For this one, you want to look for any tendons or blood vessels first. You're going to take the bevel of the needle, hold it against the skin, and you're going to insert at 15 degrees or less of an angle, and you're going to look for the blood, which is going to be at the site of the injection. Our next one is going to be the abdomen, so you can go ahead and lay down. So the abdomen is going to be for subcutaneous injections, and it's good for repeated injections such as insulin or heparin. So for this one, you want to go 2 inches around the umbilicus. You don't want to go above the costal margin or below the pubic, and you don't want to go past the sides of the anterior superior iliac spine. So that's going to be this bony prominence right here. So you're going to have a nice U right here. Please stop laughing. You're going to have a nice U right here. And you can administer your injections 3 finger widths apart. So as you can see, there's a lot of injection points right here. And like I said, this is going to be for subcutaneous injections. And depending on the amount of tissue, depends if you insert at a 45-degree angle or a 90-degree angle. So the next one, you're going to have your patient lay in a side-lying position facing towards the nurse. So I'm going to have you roll this way for me, please. So for this one right here, it's going to be the ventrogluteal site. This one is going to be located, I'm actually going to have you switch spots with me right here, Mom. Mm-hmm. This one, to locate it, I'm going to take my right hand on the patient's left-hand side. I'm going to find the bony prominence, which is going to be the greater trocar, trocar canter, and greater trochanter. Please stop laughing, you're distracting me. The greater trochanter. I'm going to place the heel of my hand right here. I'm going to point my thumb towards the groin, my index finger towards the anterior superior iliac spine, and my middle finger towards the pubic, or towards the iliac crest. And it's going to be this triangle right here. This is going to be the site of the injection. This is going to be a preferred injection spot for intramuscular injections. So if the patient doesn't have a muscular spot right here, you can move it around to adjust. But you would want to insert at a 90-degree angle. So the last injection site is going to be the vastus lateralis. It's going to be on the thigh. So for this one, you also want to find the greater trochanter again. So you want to go a hand breath below and a hand breath above the knee. You don't want to go past the midline of the top of the leg or past the midline of the side of the leg. So it's going to pull this up a little bit. It's going to be this section right here. And this is going to be for larger intramuscular injections or subcutaneous injections. So for this one, you would as well, for intramuscular injection, insert at 90 degrees, or for a subcutaneous injection, depending on the amount of subcutaneous tissue, 45 degrees or 90-degree angle. And that's the end of my injection site video.